Hello friends, in this video we are going to talk about the nephritic syndrome versus the nephrotic syndrome. It is a number of the clinical syndromes which are associated with the glomerular diseases. So let's first talk about the acute nephritic syndrome. It is associated with the hematuria, proteinuria, hypertension, edema and oliguria. In hematuria, uh, urine has slightly smoky appearance, and also the erythrocytes are detectable by the microscopy, and also the appearance of red cell casts is one of the feature of the acute nephritic syndrome. Then proteinuria is mild, less than 3 gram per 24 hours, and is usually non-selective. Then hypertension is mild. Edema is also mild. Edema is due to the sodium and water retention. Then oliguria. These are the features of the nephritic syndrome: hematuria, proteinuria, hypertension, edema, and oliguria. Nephrotic syndrome is characterized by the heavy proteinuria, hypoalbuminemia, edema, hyperlipidemia, lipiduria, and hypercoagulability. So, in proteinuria, there is heavy proteinuria, protein loss of more than 3 gram per 24 hours. Normally, what happens is that a small amount of protein is passes through the glomerular filtration barrier, and um, some of the proteins is reabsorbed by the tubules. But in the uh, nephrotic syndrome, what happens is that uh, excess of protein is filtered, and uh, the tubules is not able to reabsorb all the proteins which are excreted or filtered from the glomerular filtration. So basically what happens is that the protein, the filtered protein is more, so that it will exceed the range that tubules can maximum reabsorb. So let's for example, imagine hypothetically that 10 units of proteins can be reabsorbed by the tubules maximum. But in the disease, what happens that filtration of proteins is 13 unit or more than that. So what happens that tubules can absorb only 10 units. So there are 3 to 4 or whatever the amount extra filtered is released in the urine. So this is the um, mechanism. Now there are other features of protein loss is its selectivity, meaning that a highly selective proteinuria mainly consists of loss of low molecular weight proteins, while a poorly selective proteinuria is a loss of high molecular weight proteins in the urine. In nephrotic syndrome, a proteinuria mostly consists of loss of albumin. So the other feature is hypoalbuminemia. Okay, it is due to the increased urinary loss of albumin and inadequate hepatic synthesis of albumin, meaning less synthesis of albumin in the urine. The plasma albumin level will decrease up to the 1 to 3 gram per dl, while the normal is 3.5 to 5.5 gram per dl. Okay. The concentrations of other proteins in the plasma, such as immunoglobulins, clotting factors, and antithrombin, may also fall and leads to the uh, infections and thromboembolic complications. The third one is the edema in nephrotic syndrome appears due to fall in the colloid osmotic pressure due to the hypoalbuminemia and also due to the sodium and water retention. The next feature is the hyperlipidemia. Its exact mechanism is not known, but it is hypothesized that the liver faced with the stress of massive protein synthesis because of the massive protein loss leads to the increased synthesis of lipoproteins. These are increased blood levels of total lipids, cholesterol, triglycerides, VLDL, and LDL, but decreased in HDL. So it is a not good condition at all. Low blood level of HDL is partly due to its loss in the urine. Next feature is the lipiduria. It occurs following hyperlipidemia due to excessive leakiness of glomerular filtration barrier. Okay, and the next feature is the hypercoagulability. So it is due to the urinary loss of antithrombin 3, hyperfibrinogenemia from increased synthesis in the liver, then decreased fibrinolysis, increased platelet aggregation, and altered levels of protein C and S. So let's summarize the nephrotic syndrome and its features. First one is the heavy proteinuria, more than 3 gram per deciliter. Then hypoalbuminemia, edema, hyperlipidemia, lipiduria, and the last one is hypercoagulability. Now let's talk about the difference between the acute nephritic syndrome versus the nephrotic syndrome. First feature is the proteinuria. It is mild, less than 3 gram per 24 hours. In nephrotic syndrome, it is heavy, greater than 3 gram per 24 hours. Hypoalbuminemia is seen in the nephrotic syndrome. Edema, mild in loose tissues, but in nephrotic syndrome, generalized and marked and generalized and peripheral. Mechanism of edema. In acute nephritic syndrome, it is only due to the sodium and water retention, while in nephrotic syndrome, it is due to the decreased plasma osmotic pressure and sodium and water retention. Why decreased plasma osmotic pressure is due to the hypoalbuminemia. Okay. Now, hematuria is present in the acute nephritic syndrome while absent in the nephrotic syndrome. Hypertension is present in the acute nephritic syndrome mainly, but in nephrotic syndrome, in advanced disease, can be present. Hyperlipidemia is absent in the nephritic syndrome, while present in the nephrotic syndrome. Lipiduria is present in the nephrotic syndrome. Oliguria is present in the nephritic syndrome, and hypercoagulability is present in the nephrotic syndrome. So this is the difference between the nephritic syndrome versus nephrotic syndrome. Thanks for watching. Hope you enjoyed the video.